On September 12, 2019, the Wuhan Institute of Virology's database of viral sequences was suddenly taken offline in the middle of the night. The deleted database included a huge collection of bat virus sequences. The database has never been publicly recovered. The database, which contained more than 22,000 unpublished sequences of bat and rodent viruses, could be crucial to determining the origin of the COVID pandemic. To this date, there have been no known requests from public health officials to reinstate or to examine the database. None of the major health officials involved in the pandemic response, such as Anthony Fauci, Jeremey Farrar, and Francis Collins, have publicly acknowledged the database's existence. Hi everyone, and welcome to Truth Over News with Jeff Carlson and Hans Manke.
Earlier this year, the World Health Organization sent an investigative team to Wuhan. Their report states that as part of their analysis, they reviewed data collected through the China National Center for Bioinformation Integrated Database on all available coronavirus sequences. But the World Health Organization's team failed to make a request to examine the database of viruses collected, maintained, and later deleted by the Wuhan Institute of Virology. The WHO's failure to pursue what should have been its most promising investigative lead is particularly notable, as the Wuhan Institute of Virology is widely regarded as perhaps the most likely source of a viral lab leak. Peter Daszak provided an excuse for the WHO investigators, claiming that the World Health Organization's investigative team did not request to see the deleted Wuhan databases because Daszak told them that the data did not contain relevant information on the pandemic's origins.
We did not ask to see the data. We do basically know what's in those databases. I gave a talk to both sides about the work we've done with Wuhan Institute of Virology and explained what's there.
It beggars belief that the WHO would accept Daszak's assertions at face value, rather than insisting upon examining the Wuhan Institute of Virology's database for themselves. It's also worth noting that Daszak was inherently conflicted, as he had been actively enmeshed with the Wuhan Institute of Virology's activities for years.
Shizheng Li, the director of the Wuhan Institute of Virology, later claimed that she deleted the database because of alleged hacking attempts, despite the fact that this information was supposed to be publicly available according to Daszak's funding agreement with Fauci. A hacking attempt, if indeed there was one, is also not a reason to permanently delete a database. It could have been easily reinstated or simply made available for examination offline. There is simply no excuse for the World Health Organization's failure to examine the Wuhan Institute's database, particularly in light of a September 2019 World Health Organization report that specifically warned of the possibility for a global pandemic. That report, which stated that the world is not prepared for a fast-moving, virulent, respiratory pathogen pandemic, was published only 6 days after the Wuhan Institute deleted its entire database of dangerous pathogens. There is no suggestion that the authors of the World Health Organization report had foreknowledge of the pandemic outbreak. But the fact that the World Health Organization's September report warned of the potential for a viral outbreak spreading rapidly across the globe at the same time that the Wuhan Institute deleted all its dangerous pathogen data should have immediately caught the World Health Organization's attention. However, there seems to be no contemporaneous record of anyone at the World Health Organization objecting to or at least querying the database's deletion.
The timing of the Institute's decision to remove the database of virus sequences is particularly deserving of investigation in light of events that immediately followed the database's deletion. According to a report by NBC News, there was no cell phone activity in a high-security portion of the Wuhan Institute of Virology from October 7th through October 24th, 2019. The inference drawn by NBC News' verification unit was that there may have been a hazardous event at the lab in the time leading up to October 7th. At this same time, according to a Harvard Medical School study, an increase in traffic at hospitals throughout Wuhan took place. The Harvard study appears to have been validated through the observations of the U.S. Consul General in Wuhan, Russell Westergaard, who stated that by mid-October 2019, the U.S. consulate in Wuhan knew that the city had been struck by what was thought to be an unusually vicious flu season. Westergaard would later note that the disease worsened in November. Westergaard also stated that when Wuhan city officials began to close public schools in mid-December to control the spread of the disease, his team passed the information to the U.S. Embassy in Beijing while they continued to monitor the situation. Around the same time that Westergaard was raising his warnings, likely at some point in early November, 3 lab workers at the Wuhan Institute of Virology were reportedly hospitalized with COVID-like symptoms.
Huang Yanling, a researcher at the Wuhan Institute of Virology, who's been rumored to be patient 0, also appears to have disappeared during this time frame. Her profile was subsequently scrubbed from the Wuhan Institute's website. The annex to the World Health Organization's 2021 investigative report, which describes Huang as a former lab worker, notes that according to the Wuhan Institute staff, Huang was an alumnus who graduated in 2015 and was now working in a different province. The annex stated that Huang did not want to talk with the media and also noted that she'd been contacted and tested and ascertained to be healthy. Just as it did with the Institute's sequence database, the World Health Organization showed a curious lack of interest in Huang's case. Huang's profile on the Institute's website remained active until after the pandemic outbreak. And Huang can also be seen in Wuhan Institute group photos dated as recently as 2018.